Many children and adults live with asthma, but understanding what that means and how to take care of a child with asthma can sometimes be difficult. When a doctor tells you that your child has asthma, what they are saying is that the airways or tubes that carry the air your child breathes down into their lungs don't always work the way that they're supposed to. Here's a diagram of how the tubes are supposed to look, nice and open for the air to move down and into your lungs. Sometimes these tubes overreact to different things in the air or environment. When this happens, the tubes become swollen or smaller than normal, and they often fill up with mucus, making it difficult for your child to breathe. In this picture, you can see how much smaller the tubes are and how there is less room for the air to move down and into your lungs. This is what we call an asthma exacerbation or attack. Your doctor has given your child medications to help keep their airways or tubes nice and open, and therefore it's important to make sure that your child takes their medications every day. You may notice that certain things trigger or cause an asthma attack in your child. Some common triggers include tobacco smoke, infections, exercise, house dust, and mold. We call these things triggers because they are triggering or causing the abnormal reaction in your child's body that leads to their airways or tubes to become smaller and clogged with mucus. Since viruses are a common trigger, it is important that your child receives a flu shot each year. So remember, in order to keep your child's asthma under control, help to make sure that they are taking their medications as instructed by the doctor, and help them to avoid their asthma triggers as much as possible. If you have any questions, you can always call your doctor's office and set up an appointment or talk with the school nurse. For more information on asthma medications and asthma control, please view the next short video. There are two main types of asthma medications that your doctor may give your child. Both of them come in the form of an inhaler or through a nebulizer machine. Flovent, Pulmicort, and Qvar are a few common examples of what we call controller medications. The goal of these medications is to control your child's asthma on a daily basis and to prevent an attack from happening. Each child is different and will have different instructions on how often and how many puffs to take of their controller medication. It is therefore extremely important to ask your child's doctor what the instructions are specifically for your child. The second most common medication used in the treatment of asthma are short-acting medications or rescue inhalers. These medications work quickly to open up your child's airways or tubes to help them breathe better. An example of a common rescue inhaler that your child may have is albuterol, ProAir, Ventolin, or Proventil. It is important that you and your child know the difference between these two medications, preventive and rescue, because they are used in very different ways. If you ever have any questions about which inhaler should be used and when, be sure to ask your school nurse or your child's doctor at their next appointment. Finally, it is important to know that your school nurse has the ability to give your child any medication that they may need during the day. Our goal is to minimize how many days of school your child misses each year due to asthma. Be sure to speak with your school nurse about how they can help control your child's asthma while they're at school. Now that you understand your child's medications, click on our next video to learn more about their asthma action plan. Every child with asthma should be given an asthma action plan by their doctor. These plans are helpful tools to let you know which medications your child should be taking and when, based on how they are feeling. You can also use something called a peak flow meter to track how well your child is breathing in order to know which medications they need to be taking and how often. If you don't have a peak flow meter at home or your child has never used one, be sure to ask your doctor if he or she recommends one, how to get one, and how to use it properly at your next appointment. As you can see, asthma action plans have a green, yellow, and red section, just like we see on traffic lights. The goal of an asthma action plan is not only to guide you and your child on when to use which medications, but ultimately to keep your child out of the emergency room and out of the hospital as much as possible if they do not need to be there. All plans start with a green section, which is where your child will be when they are healthy and breathing easily. In this section, your doctor will write down which controller medications your child should be taking every day in order to keep their asthma under control. If you're unsure of what a controller medication is, go back and watch our short video on asthma medications. The yellow section on the plan is for when your child is having a little bit of trouble with their breathing. It is also known as your child's sick plan and often indicates the beginning of an asthma attack or a cold or allergy season. Some signs that your child is in the yellow section of their asthma action plan include complaints that it is difficult to breathe, that their chest feels tight, or nighttime and early morning coughing, as well as episodes of wheezing when they breathe. The instructions in your yellow section may change how and when your child takes their controller medication. It will also add a rescue inhaler to your child's daily medications. If your child is on their sick plan medications but they are not getting any better, then you may be entering the red section of your asthma action plan. At this point, it is important to contact your doctor or go to the hospital emergency room. A few good rules about when to get immediate help for your child include if their medications are not helping, if breathing is very difficult for your child, if they are unable to walk or play, and if they cannot talk easily. Of course, if you ever have a question about how your child is doing, what medication they should be taking, or whether or not they need immediate help from a doctor, you can always call your doctor's office. Remember, asthma action plans are different for each child and can be confusing, so make sure to ask your doctor to go through your child's plan with you at your next appointment, and always make sure that the school nurse has a copy.